Great day to you all out there. Hope you're doing well. And as you can see by the title there, if you're having persistent low back pain, I know it's not going well. I know you're having issues. I know it's not fun. I know it's not something that you want to go through. And I've experienced low back pain myself. And I guess I'm grateful for it because now I have a better understanding of what you're going through if you're having it. Now, mine didn't persist for months, but it did linger on for a few weeks. And thankfully, I knew what to do. I knew who I needed to see. And when it was going on, when I couldn't stand for very long, my wife says, let's go to the emergency room. And my exact response was, this is an emergency. It's just a chiropractic emergency. I need to see a chiropractor. I saw one every day for a week. And then periodically after that. And then it went away. It got better. So if you're dealing with low back pain, if you're dealing with an issue like that, I know how debilitating emotionally, mentally, physically, it taxes on you. I get it. And I'm sorry to hear that, but here's the thing. It's just a message saying something's not right. You know, back pain can come from different things. It could be a misalignment of the vertebrae, the subluxation we talk about. It could be a disc injury. It could be a soft tissue injury, meaning the ligaments, the muscles that support and move the bones are injured. Or it could be a combination of all that. So is it one thing? More than likely not. It's probably a combination of all the above. The subluxation, the disc, the soft tissue. And that's where the issue starts to gnaw on you. Is that I can't even go to the bathroom. I can't even get up to do anything. You know, much less having to just walk for 2 steps. It's tough. I've been there. I know. And I'm sorry that you're dealing with that, if that's you, or maybe someone you know. But here is the good news. Chiropractic care helps. So if you're one of those that doesn't want to drug it out, cut it out, chiropractic care is for you. That's the good thing. Where we help individuals without drugs or surgery. And that's the important thing, is that you're getting help. Now here's the thing. The healing part can take days or weeks, or for that fact, even months. It depends on the injury. And everybody heals at a different rate. The healthier person is probably going to heal faster than somebody who doesn't take care of themselves. That's just the facts. That's just the limitations that we're dealing with there. So, but if you're dealing with persistent low back pain, you're like, well, what's chiropractic going to do? Well, here's the main thing. It helps with the pain management. Helps you able to tolerate the pain better by increasing the mobility, the flexibility of the joints. Now, sure, depending on your issue, that we'll probably recommend other things like diet. What you eat matters. If you're eating foods that cause inflammation, you're going to have an issue. You want to make sure you're eating more of an anti-inflammatory diet. That's something that we'll talk about. The more we get to know you and your lifestyle, and there may be activities that you do that probably aggravate it. And so that's where we get to learn you. And you get to learn us too, as a matter of fact. So chiropractic care can help with the flexibility, mobility, the pain. You know, everybody heals at different rates, as I said before. So if you're coming here and expecting, and some people do this, unfortunately, they come here and expect one adjustment, one treatment, one of anything to help. And does it help? Certainly. Does it get you out of pain? Maybe. I've seen people crawl in here, literally, hands and knees crawl in here and walk out. as I said before, everybody heals differently. So I don't want to sit here and say, oh, it's going to take this long or it's going to take this short amount of time. Everybody's different. So when it comes to healing, just know that, hey, your injury may get quick response. It may take a longer response. So, as you're taking good care of you, your posture's improving, your alignment's improving. Hey, even your muscles get stronger around the injured point. That's the important thing. Your body's healing and adapting. And then once we get you to a state that, hey, it's not that bad. I can walk now. Oh, I can do other things. I can go to work now. It's the important thing, right? Or take care of my kids. Those are important things that we have to do and need to do. And if you can't do those things, that's why it's so taxing. But when we get back to that point of able to get back to life, continued chiropractic care helps prevention of future injuries, further injuries to that area. So I'm talking about the low back pain today, but the whole spine, the whole body benefits from chiropractic care. And if that's you or someone that's been dealing with low back pain for years, got it. It happens. I'm sorry to hear that. But just know there is hope for you. There is hope. And I've seen hundreds of people with low back issues, different severity, some that can't walk, some that haven't been able to do much for years. And you can imagine the longer it's been with you, the longer it's going to take to get you well, to get you where you can do some things. And some of my patients, hey, we just want to get the mobility back in there. They've had surgeries, they've had injuries for a while now. We just want some mobility. We just want some management of the pain. And that's the kicker there too, is that sometimes it's not even the pain. It's more so the mobility. The legs, the feet don't move as well. Now, I've seen young people have a gait of a 9-year-old person. They can't hardly walk at all. And it's not age dependent, by the way. It's the amount of the injury that you have. So just know that the quicker you handle any injury, the better the prognosis, the quicker the results of healing. So if this is you, please don't wait any longer. Let's take good care of you. And if you know somebody that's dealing with persistent low back pain, please share the message. These messages that we put on here, please share them. They're meant to be shared. They're meant to encourage others to take good care of their health. If it's not you, share it. If it is you, hey, hope to see you soon. Especially if you don't want to drug it out or cut it out. We're the place for you. Because we've been helping families in the West Point area and the surrounding communities get out of pain without drugs or surgery. That's the big thing. Without the drugs or surgery. And the quicker we get onto it, the better the prognosis. So if you're interested, if that's you, please go to westpointfamilychiropractic.com. In the space provided next to my picture where it says learn how, put in your email address. And then we're going to send you information on how we can accomplish this in 3 easy steps. So we're going to walk you through it before we get you in the office. I'm Dr. Brenton Jones, West Point Family Chiropractic. We're here for you. We're here to help you with your lifestyle, help you with your health. And in the meantime, we'll teach you about chiropractic too. Share this with your family, share this with your friends. They need to know that there is hope And that's the big thing. If you're walling around without hope, life gets pretty despair. But we want to give you hope. We want to let you know that we have helped hundreds of others get the relief that you need. I'm Dr. Brenton Jones, West Point Family Chiropractic. Hope to see you real soon. Oh, and by the way, I didn't give you my cell phone number. My office number is 706-645-1033. The address is 1106 3rd Avenue, West Point, Georgia. I mentioned my website earlier, westpointfamilychiropractic.com. Please come by and see us. Give us a call. Visit our website. There's all kind of articles that we have on our website. We have blog articles on there. We have testimonials, videos on there. So please visit it, check it out. I'm Dr. Brenton Jones, West Point Family Chiropractic, and we'll see you real soon.